everybody, and very, very warm welcome to you all for this month's vlogcast. I am really happy here to present Maz and introduce Maz. Many of you know Maz. She does so much work behind the scenes, and MPN Voice wouldn't be where it is now without you, Maz. So I know you and I know each other quite well because we've worked together for a long time, but I'm really happy for you to join me today, because I think your story is an important one too, as to how you came to be involved with MPN Voice. And I'd just like to ask you how you and when you were diagnosed with an MPN.
Well, hello, Nona. Thank you very much for inviting me to one of your In Conversations. It's very nice to be here, and thank you for that lovely, lovely introduction. I was first diagnosed with ET in 2003 after experiencing symptoms of dizziness, head pain, confusion. And my GP first of all thought it was probably some sort of allergy, that type of thing, and put me on antihistamines, etc. But unfortunately that wasn't it. It kept on carrying on and on, so it eventually led to a referral to an ENT consultant who was absolutely brilliant and said it was nothing to do with any allergies and it wasn't anything to do with an inner ear problem or balance, etc. He said he did think it was something to do with my blood. He wasn't quite absolutely sure, but he wanted me to see a haematologist, so sent me off with some blood tests, and back came the blood test with raised platelets, and I was then put forward to the haematologist.
My goodness, what a journey. How did you cope with all that? Because it seems that you went around the houses a bit to begin with. So how did you cope with that? Because it's one thing not knowing, isn't it, what's wrong, knowing you've got something wrong. But you know, if you've got any tips on how to cope with it, that would be really useful.
Yes, it was very stressful at the time, going through all of that and being put on different medication. I wasn't just put on antihistamines, which unfortunately I couldn't tolerate for very long. I can't take them anymore now. And I do get hay fever now. I wish it had been just hay fever and an allergy back then. But then I was put on various other medications for balance disorders and inner ear problems because they thought that could have been it. And the whole thing just kept rolling on and rolling on. And I really just wasn't very well at all, and suffering quite badly with the symptoms. And it started to have quite a bad effect on me. And I was working full time as well in quite a involved and stressful job. I was a office manager in a GP surgery and a trainer of staff, etc. So it was quite full on, and it was very difficult to cope, although the GPs that I worked for were very considerate. But it was just such a relief when I finally got an answer to what these symptoms were, and that I had a name for this condition. Not that anybody really knew what it was. Even the GPs I worked for didn't really understand it, but they were brilliant. They started looking into it for me. But it was just hard to cope because feeling so tired and the fatigue and the dizziness all the time. But people around me were very, very helpful. And I just explained to people that, you know, I'm having a bad day and I can't do as much as I could. And some days I just had to go home from work and just sit, you know, on the chair and just do nothing and try and hold my head, because it was just going round and round all the time. And I just wanted it to stop. And even just doing that wouldn't stop it. Obviously it wouldn't. So yes, it was very, very tough. But the relief once I found out what it was after a bone marrow biopsy and the blood tests, to be told I had ET, and that my haematologist was lovely. He was an elderly chap, but he was so reassuring and said, you know, you will live a normal life unless you have something really drastic like a heart attack or stroke, but lots of people get those anyway. And just take your aspirin and you'll be absolutely fine, and we'll see you in a couple of months, and just, you know, carry on with your life. So that was it.
And how has the journey of your ET been? Because you've had it for a long time. Has it remained stable, or have you had blips along the way?
I was stable for a while. I sort of kept getting the dizzy spells and confusion and head pain, but I did manage to sort of cope with those and pace myself during the day and do what I could when I could. But then after a couple of years, I moved up to Derbyshire, and it just the symptoms really then started to get really, really bad, where I was suffering daily for and could be weeks, could go for weeks on end, where I just really couldn't function properly. So it meant, again, lots of time off of work. Fortunately, they were very good about it, and it just started to really, really impact on me. My quality of life was just shot to pieces, basically. I didn't have a life, and I was really getting desperate as to how I could find a way out of that, because I just didn't want to live like that for years on end. And that's when I spoke to my consultant hematologist in Derbyshire, who suggested that possibly going on hydroxycarbamide would help with these symptoms. He said he did think it would help, it would reduce the platelets, though that he didn't think that that was causing the symptoms. And we know that that doesn't always relate to the symptom burden, your high platelets. And I was so frightened when he told me I had to start taking them. I was absolutely petrified. And to be honest, I cried in the pharmacy while I was waiting for the prescription. And when I got home to take the first one, it took me about an hour, I think, of just staring at it in my hand and trying to put it in my mouth. And I just thought, what have I got to lose? I either take those or I have no quality of life. I've got to see if they will work. And if they work, it will be amazing. And thankfully, they did work for me. And I've been absolutely fine. I do get breakthrough days where I have the symptoms. I get fatigue and I get dizziness and I get head pain, but it's not very often, and I do manage to cope with it now. As you know, I work full-time now for MPN Voice, and I just am able to work around some of those symptoms now, and I've got more used to them, more able to cope with them. And it was at that time when I went onto the hydroxycarbamide that I, feeling so ill, that I wanted more support, and I didn't know what was out there, and just was trawling the internet to find something. And that's when I found NPD support, as it used to be called. And I just was reading so much on the website, and I thought, that's me. They're describing what I've got, and they can help me. They can tell me how to cope with it. And that's why I got in touch, and I was so glad that I did, because it helped me so much.
It's really interesting, Maz, how often, and particularly in the early days, people were left at sea. When you talked about the fear of taking the tablets, I certainly have heard so many people say, of course, in those days on the leaflet, you were being treated for cancer.
Yes.
And I think, I don't know whether that was part of the fear, the fact that it was definitely a treatment for cancer.
I think it was actually, yes, although at that time it was still called a disorder, because that was back pre-2008, obviously. So my ET was then still a myeloproliferative disorder, but then I was given chemotherapy medication, and I thought, well, hang on a minute, chemotherapy is to treat people with cancers. I've got a blood disorder, how is that going to work? And that was part of the fear, definitely, of thinking, well, why? What's this about? How come this is going to treat my blood disorder? Is this absolutely the right medication? Have I got the wrong patient or something? But of course, yeah.
I can identify with that. It's pretty scary when it's bad enough when you're going down a path of doctors not knowing what's really wrong with you, and then finding out that you read a word that didn't apply. I still think, when I was diagnosed in 19 91, it was definitely a blood disorder. It wasn't, you know, I still think of it that because it's just the way it is. But anyway, let's talk about MPN Voice, because I remember meeting you at a forum at St Thomas's, actually.
Yeah.
And I think that's where you started to get involved. I know that's a long time ago. And just briefly, MPN Voice, as we know, has evolved hugely since the pandemic, because we had to get our act together. Where do you see your pivotal role in MPN Voice? Where would you like to see it be, say, in 5 years' time, MPN Voice?
Ooh, well, yes, it was a very long time ago that we first met at that forum in St Thomas's when I came along, and I started to get involved with all of you and taking on more things to do. And it has evolved so much over those years. And as you say, we did grow much bigger during the pandemic. We had to doing different things with the online support and the virtual forums, which have been absolutely amazing. I just want MPN Voice to carry on growing, getting bigger, and continuing to support the MPN community, not just the patients, but their family members and their friends, and the healthcare community as well, healthcare professionals. And I just want us to carry on with doing the fantastic work we do with the support, but also the research that we do. I think that is so important. And we do want a cure. We do want to know why we've got these, and we want a cure for them, maybe not in our lifetime, but for those that are coming behind us, particularly for the younger people. And I think that MPN Voice does a fantastic job in supporting research projects that are MPN based. And I think that is so important, that we just support everything and everybody with MPNs, and we focus on that. And I really just want us to keep growing and make the community much, much bigger. I know we support people across the world, but I want us to be the biggest MPN support organization in the world.
I think it's a wonderful aspiration to have, and indeed, when we do our virtual forums, they do go around the world, and it never ceases to amaze you and I when we see the registration list of the countries that we now reach out to. Maz, it's just been a wonderful opportunity to talk to you about your disease process. And also, again, many thanks for all that you do for MPN Voice. And also, I think we can both say we're really glad we're back on the road again, and look forward to seeing people in Chester, Newcastle and Cardiff and London face to face.
Yes, I agree with you. Thank you so much, Nona, for giving me the opportunity to talk about myself and about MPN Voice. It's been fantastic to do this. Thank you. And yeah, I agree with you, getting back out to the forums. I can't wait to get back amongst our lovely MPN community, because it is wonderful to see all the people that come along and their families and their friends, and to talk to them. So people that we've known for many years come along, and meeting new people. It's just amazing. So thank you very much indeed.
See you soon.
See you soon.